Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Going to be speaking with Mr. Nathan White, Chief Client Officer of RxBenefits. He's joining us here on the program to talk about how data analytics combined with the clinical oversights can reduce costs for employers and improve health outcomes for members. Welcome to Health Professional Radio. Nathan White, thank you so much for joining us.
Thanks, Neil. Glad to be here.
Give us a little bit of insight into your professional background and then talk about your role there specifically at RxBenefits briefly.
Sure. Yeah, no, I'm happy to. I serve as the Chief Client Officer here at RxBenefits. And for those of you that are not familiar with us, we're the benefit industry's first and only pharmacy benefit optimizer. I've been with the organization for over 4 years, but before I joined the team, I had almost 20 years of experience via some executive roles that I held within two of the three biggest PBMs in the United States. If I had to describe myself, I'm a self-proclaimed pharmacy benefit nerd, having established myself as an industry resource. In really unique markets, organizations that require some additional handholding, that's really where I've excelled in the past.
Pharmacy Benefits Optimizer. Briefly describe exactly what that means, a Pharmacy Benefits Optimizer as a provider.
Yeah, it's definitely a new term in the industry, and really PBO or Pharmacy Benefit Optimizer, really means that unlike a medical carrier like the Blue Cross Blue Shield or a PBM, we work exclusively on behalf of the consultant as an independent advocate for the employers, the members that they serve. And really, we look to optimize the value of the pharmacy benefit that they utilize. And we really do this in three unique ways. And you got to hold me to this because sometimes I say 3 ways and I list 10 things. First and foremost, we have to manage the pharmacy plan to the lowest net cost. And that requires a comprehensive approach, but I think it starts with the contract and being able to access, really good rates, rebates, and contract terms in order to achieve that. So ultimately, RxBenefits through our PBO model, we leverage our massive size and scale to help middle market employers buy, like a Fortune 10 employer. So I think that's really the first component to this PBO model. Mm-hmm. The second is implementing the right mix of clinical management programs to eliminate wasteful spending, really optimize those therapeutic outcomes and maximize the value for the employee benefit and ultimately drive down the pharmacy benefit costs. Mm-hmm. And the third, and I mentioned I'm going to try to keep it to 3, Neil. It comes with the experience, right? So, employees, members, some members utilize their pharmacy benefit daily. Some don't use it very often at all. But when you do use your pharmacy benefit, you want it to work. And, you want to know that if you have questions, you have somebody that you can call and interact with to address your unique needs. And that's really the third component to it. So really cost savings, driving away wasteful spending, optimizing utilization, and then more importantly also, meeting their needs from a service perspective. That in a nutshell is what a PBO is.
In the midst of the COVID-19 pandemic, you've recently experienced some significant growth. Talk about this growth and talk about how the pandemic has affected the growth of your company and what do you see going forward?
Yeah, it's a good question. I think, we've obviously continued to grow mainly because we're highly aligned with the broker consultant market and more importantly, the employers that they serve, right? So our interests align, completely with those types of organizations. Certainly during the pandemic, where employers are looking to save dollars in any way that they can, our model becomes that much more important. We truly are an advocate for those organizations. And, employers, middle market employers have everything going against them, right? So, there's been a rise in pharmacy benefit costs, with, the introduction of many high cost specialty medications. Yes. There's been consolidation in the pharmacy benefit market. And I think everybody is well aware of many of the PBMs that are out there that are serving the needs of 85+% of Americans. Those organizations are now highly aligned, with the carriers. And, frankly, not necessarily aligned with middle market employers. So those middle market employers aren't always able to access the best rates, rebates, discounts, contract terms, because those organizations are seeking, large, municipality accounts, organizations that are going to move the needle for them financially. So middle market employers sometimes becomes an afterthought. And, when they do work directly with those big PBMs, and again, there's nothing wrong with the big PBM model, but, they're not going to get that same, service experience that they would get through a PBO or an organization that's highly aligned with their interests. So I think people have gravitated to our model because we've been able to address these challenges that the middle market employers are facing. And we've truly been an advocate for the brokers that serve these types of organizations as well. Very confusing market. And, being an advocate for these brokers, educating them on, utilization, spend, and trends that we're seeing in the industry is really where we've excelled, and it's obviously led to incremental growth.
How seamless a transition has it been for these organizations to adopt your ideology when it comes to minimizing these costs and, not leaving employees vulnerable?
Yeah, it's a good question. And, I think first and foremost, anytime you make a transition, on your pharmacy benefits, it could be highly disruptive. So I think we've done a good job, for new clients addressing where there will be disruption and getting out in front of it and educating the employees and members on the transition. I mentioned before, the comprehensive clinical solution that we deploy to help save further dollars. That's highly targeted on those individuals that are driving 40 to 50% of spend. And in most instances, that's only 1 to 2% of the population. Mm-hmm. So, it's not highly disruptive to try to find opportunities to save dollars and align with the interests of the employer when it's really only a small subset of the employees that are driving the majority of the spend.
Give us a website where we can learn more about RxBenefits and about the concept and the reality of PBOs.
Yeah, definitely. So, certainly you could go to our website at www.rxbenefits.com. You could also follow me on LinkedIn. I frequently post content and information about our PBO model and about, how we're helping save middle market employers dollars every day.
Well, I thank you for joining us here on Health Professional Radio. It's been a pleasure speaking with you. Thanks.
Thanks, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Nathan White, Chief Client Officer of RxBenefits. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.